it's coming out colour, but this is what I'm living like. Unable to use a wet room because of the disrepair and unsafe conditions. 20th of 10th 2018, I ended up with a sudden reduction in my health disabilities in the United Kingdom. Witnessed by my daughter-in-law live on Facebook video live streaming on the 27th of 2017. This national housing company, Home Group Limited, UK, the key, all the emails, all the complaints procedures, the key, all the emails, all the complaints procedures, all of the gone through every statutory services, everything I've done with help, obviously. I can't do it myself anymore. It's got nowhere. So now I'm in the hands of the new statutory system, which has been over ever since I contacted the public sector side, i.e. adult health social care, but it's now the public sector side, i.e. adult health social care, but it's now cut back to my area since end of December, January, February, well up to date, and I no longer have the current social worker offer, and they were going to offer me a occupational therapist assessment and all this as well, housing and what can be done to get me out as an emergency basis, like as soon as safe place where I was to temporarily move to. And well, I offered 2 places recently again. One was last year to a hotel, Bond, Blackpool, Westbite Hotel type place, my high complex disability needs, and that got rejected. I got all emails, proof, evidence that what was going to be offered to fund me, and there's no disability training, no disability awareness in my area, East United Kingdom, for any housing employees. And it's the same where who I ever deal with. My informal private life friends who work in occupational therapy themselves in private healthcare are struggling on the bare minimum of my personal daily care task needs. I cannot walk, I can't self-care at all, and I'm deteriorating because of the mould and all the blackness around everywhere. These sheets are there just to have to wash me out of buckets, fill the buckets up, bring it into my bedroom with all the transferring medical aids I got, and if my doctor or any other practice doctor came here, they would be horrified, and they will have to do emergency safeguarding because the housing disrepair is affecting my health and safety, and it's affecting my psychological well-being, I think they call it now, innit? And this has been going on too long. So yes, I've ended up in hospital, have accidents again this year, and now I'm in the middle of dealing with a nightmare. I mean, I've tried to source local help, you called it, is no point in going through all this complaints procedure, this immediate action and repairs I need. And again, my friend emailed on the 8th of the 10th 2018 to offer a local hotel that has a level access shower room with a big enough room for me and my medical equipment, and get the assessment OTs, occupational therapy done, and also carry on with the Care Act 2014 assessment process that's been stopped out the blue without my consent on the 20th of 2018 in my area. And now the social worker's leaving. That was up at, I can't believe everything else is kicking off. I cannot cope alone at all. I have nobody else now that wants to let me down to sit in on a face-to-face in my home. And don't get me started, how disability benefits affecting thousands of people too. I am completely run down in my health. I don't know how long I can cope with all this. The winter's coming with bad snow, and I won't be able to get out to get my food. Won't be able to get my prepaid gas, electricity or gas top-up meters, like the bare minimum I can try and do when my health permits. I'm 4 or 5 days in bed than I am out of bed, and I'm wheelchair dependent. I am high care needs, and that's why I'm being blocked an awfully still. to get the choice and outcomes, the statutory national duty of care in my area, County Council, adult health social care. Despite all the emails, the evidence, and all the documentation and evidence, what is happening, how I'm reducing in my health, and the choices and outcomes meant to be offered to thousands of people that meet the criteria. Obviously, I do, and it's already been confirmed, and now they've blocked it all, everything. So I'm left deliberately, unlawfully, left like this by public servants in my area, and all the cutbacks to statutory charities and support like that. They can't even do home visits of people like me because they got thousands, I don't know how many people on their books trying to cope with, but who can come and help me? Yeah, to assist me on phone calls, paperwork, everything else I need help with, which I can't do myself. I've lost the will. I haven't got not lost the will, but I just haven't got the ability anymore. I'm too ill. And so all this is known by the medical practice and primary care in my area, NHS funding as well. They all know about all this. All the data systems, all the computer system knows about it all. Nothing passes them, you know. So I'm recording this as evidence. So I'm going public to show you just a bit of the rest of the flat is a disaster. 8 years renting, secure tender. So if you know any good bloody lawyers out there, you know, no win, no fee. I ain't got the effort. I ain't got the health to do any paperwork for legal aid agency to go that way. I ain't got the strength to go to the court. I need somebody that is going to take a no win, no fee case on. And I've got photographs and videos, and then obviously streaming about all this. I mean, all my aids, everything, the previous aids I had before I got run over in a wheelchair. I mean, all these OT reports I've had done before, housing needs reports I've had, you name it, I've had it over the years, and nothing is available that meets my needs now. It's all changed. I might meet all the high criteria, point scoring or whatever they do now for housing related new model of housing, and this is what I thought was all meant to be sorted out and going through. They've never ever offered Equality Act 2010 section 2122 a duty of care on that side either, any public sector services in my area. And I'm talking about housing, I'm talking about healthcare, I'm talking about the county council. Don't get excited by public servants, you know, political people that's meant to represent and help the individuals in their area, you know, wards. I haven't even gone to the MP yet because that is just a joke. Can't even get anywhere with that. So all these people in their nice posh houses and lifestyles, they don't care. But the monkeys, what happens if one aboard disabled people? It doesn't matter what age you are, but what the hell, you know, I don't meet the age group for age concern. I'm a 1 year out. I don't meet the age of special type housing because I'm 1 year out of that age bracket. So I've tried, and if anything happens to me again, it's the cost of the public purses on the NHS. Public, you know, if you're hard working out there and you're paying your taxes, what for? When they're cutting to the bone. And it's true, vulnerable adults absolutely being turned aside, away, and they don't care. Really don't. They just care about their own little jobs. And those managing directors are meant to be sure that safety, the health and safety, and your choice and outcomes, working with the individuals to save people as well. And trouble is, I haven't got any friends that can offer to sit in any meetings, any PIT medicals, nothing. And Capita, on behalf of DWP, smokes me about 5 times. They keep offering me appointments when I'm bedbound. I can't even consent to it. It's overwhelming psychological distress. Serious risk. So not just physically, but psychologically too. I've got to go because that mail's got to get out somehow. But when it snows and it's too cold, I'm too ill, I can't pay for things. I'm at risk that way. I can't do the shopping online. I can't do all this, that and the other, which I've been trying to get this Care Act assessment, which is statutory law 2014, it's national in the United Kingdom and England. And they're absolutely blocking me. I'm still in the short-term development team, prevention. What? I contacted the County Council because I ended up in hospital, because I've lost my reduced in my health, physically. So, and my mum's died recent, like July, and buried her in August this year, 2018. So I ain't doing too good. So thousands of people like me might not have a voice. End your recording, help share and aware, get the awareness how we're left all this now respecting the flat kitchen area, hallway, throughout the whole flat. It's so absolutely disgusting where you pay full rent and you ain't getting nothing, no repairs, anything. Gotta go.